Access to maternal care is a crisis sweeping the nation, making more than 35% of Illinois women travel at least 30 minutes to give birth.
WIFR reporter Sydney Stoffregan talked with a Rochelle doctor who's keeping OB care close to home.
It's kind of like a natural right.
More than 34% of Illinois counties are known as maternity care deserts, leaving many women without access to an OB. That's why Rochelle Community Hospital Dr. Kendall Vogler began offering pre- and postnatal services.
Usually travel around 30 to 45 minutes to get the prenatal care that they need. Being able to offer that locally is really important, not only for our community, but to have healthy moms, healthy babies, and keeping everybody close.
The farther a woman travels for maternity care, the more likely the chance for unfavorable outcomes such as stillbirth, NICU admissions, or death. That's why mothers stay under Vogler's care up to 36 weeks. Then they are connected with a delivery hospital outside of Rochelle.
OB services are very expensive, and so it's hard to maintain those. That's why our outreach to the outlier communities that we have outside of Rochelle are really helpful.
45 women have come to RCH for OB care since 2021, many of those for multiple pregnancies. Vogler says she will continue to provide everything a family needs as a provider for the whole household.
Not only do we see them, but if they have other children that we see, family members, grandparents, things like that, we're able to keep the whole family unit together.
In Rochelle, Sydney Stoffregan, WIFR News.
A recent study found that pregnant women who drive 45 minutes or more to their delivery hospital were nearly 2 times more likely to have a premature delivery than women that drive 15 minutes or less.